So radiofrequency ablation for spinal tumors is something that's been done in the past with devices that weren't predominantly made for the spine. The typical patient will come in with all types of pain, whether it's in the upper back, lower back, or pelvis. Any weight-bearing area usually can be in pain from bony destruction by the tumor. Once that happens, we look at the MRI and CAT scan to determine if it's a lytic or blastic lesion. That means that if the bone is at risk for compromise or it's not, as far as collapsing goes when someone is weight-bearing. And so we can treat patients with one or more lesions. It's hard to think of the classic patient, but any patient with metastatic disease or primary tumor and is in severe pain or pain that cannot be managed with typical narcotics. Many of these patients have lost a lot of weight, and a very small amount of narcotics make them lose their mental status or can't function in the normal way. Many times they will have difficulty speaking or being awake enough to discuss things with their own family. Therefore, to get them off those pain meds, we try interventional procedures to lessen their pain so they don't need to take such high doses of narcotics. Radiofrequency ablation can burn a portion of the tumor and burn the nerve endings that go to it. Therefore, the patient won't have the pain associated with tumor. And in addition, some metastases eat away such a large portion of the bone, we need to secure it with putting some cement into it so it doesn't further collapse. And that's called vertebral augmentation, commonly called vertebroplasty or balloon kyphoplasty. There are many techniques out there, and we kind of lump them together in vertebral augmentation, which strengthens the bone. So many patients come in and they need multimodality treatment to get them as pain-free as possible. Each patient has a very unique need, very individual biology, and we work with them based on their imaging and their concordance with pain to try and alleviate their pain as much as possible and get them to have some quality of life and the ability to ambulate and go on with their normal daily activities.